I'm Al Liske, and I had minimally invasive spine surgery at St. Joseph Medical Center in Bellingham. I have a number of hobbies that I enjoy. My wife and I really enjoy camping, traveling around, anything that is sort of hands-on, practical. I have a small shop. I have a lot of equipment, and I like to use that to build cabinets. I build furniture. One of my main activities for years has been the teaching of amateur radio classes for school groups and also for the community. 3 years ago, my back started to bother me off and on, just at various periods of time. When I taught the class, the pain was giving me some problems and did limit me a little bit in the teaching. But finally it got to the point where the pain was so severe, I was unable to really sleep comfortably at night. I couldn't find a good position to lay. I couldn't do any of the physical work that I normally would enjoy doing, various hobbies and so on. Well, then finally progressed to the point where I couldn't walk very well. I had to use a walker part of the time, and walking any great distance was a problem. So I ended up going to a doctor locally here who did steroid shots in my back for a period of time. And these steroid shots did help, and it kept me going for 2 or 3 years. Finally, he said that's all I could have. I needed to go to the next step. There was a surgeon in Bellingham that did what he called minimally invasive surgery. Then we made arrangements to see Dr. Baker, and he in fact not only told me about the surgery, but told me how it would affect me, how soon I could get back to work again, my recovery time would be short. All of these things sounded very positive to me. The magical part was the moment I woke up after the surgery, I noticed immediately the pain was gone. I knew then that this had been successful. Within a few days, I was doing all sorts of things again. I was able to be very active, and I appreciated that. I was just not to lift anything really too heavy, but that passed quickly too, and I was able to get back to work. With a larger class as I had this year, I stood up and walked considerably, and having had the surgery and the pain being gone made it much, much easier to teach the class. The new plans are, now that we're back in shape again, to take a trip to Alaska. Everybody says that's a long trip, but we're looking forward to the idea. Now I feel I'm at a point where I'll have no problem finishing these projects. I'm happy to be able to do it, and we're back at it.